the EPI-PALEO RX by Dr. Jack Kruse. Here is a summary of Chapter 9. Heart Disease and the EPI-PALEO RX Conventional Wisdom Heart Disease RX. Heart disease is the leading cause of death for both men and women in the United States, a trend observed since the early 1900s. Despite significant research funding, conventional medicine's approach, largely based on the lipid hypothesis that saturated fat and dietary cholesterol elevate blood lipids, causing atherosclerosis and heart disease, has not led to a decrease in overall mortality from heart disease. Conventional wisdom versus primal RX for heart disease. Conventional view: eating saturated fat raises cholesterol, increasing heart attack risk. High LDL and low HDL concentrations, diabetes, smoking history, and family history are risk factors. Advanced testing like hsCRP, homocysteine, ECG, ETT, and EBCT are not routinely recommended for asymptomatic, low-risk adults due to perceived poor accuracy. Treatments include quitting smoking, increasing physical activity, often cardio with low-fat, high-carb diets, maintaining a healthy weight with nutritionist-recommended grains, regular screening for hypertension and high cholesterol, controlling existing diabetes/hypertension/high cholesterol, and considering aspirin therapy for men with increased CHD risk. Statin drugs are widely prescribed to lower cholesterol, despite evidence suggesting they do not lower disease or death rates, with concerns about side effects like cancer risk. Primal RX perspective: saturated fats and dietary cholesterol may actually be preventative for heart disease. Heart disease is caused by cellular inflammation originating in the gastrointestinal tract and is influenced by hormonal responses. The best measure of cardiovascular risk is the HDL level, and the ratio of total cholesterol to HDL is a better predictor than total cholesterol alone. Low LDL is linked to an increased risk of cancer because cholesterol is essential for mitotic spindle formation during cell division. Inflammation, particularly oxidized cholesterol, is the primary risk factor, not cholesterol levels themselves. Hormonal imbalances, low testosterone, estrogen, thyroid hormones, vitamin D, and chronically elevated cortisol are linked to heart disease, often correlating with leptin resistance. Oral health, including periodontal disease and calcified dental tartar, indicating vitamin K2 deficiency, can be indicators of heart disease risk. Low T3 levels impair the conversion of LDL cholesterol to pregnenolone, a precursor to all steroid hormones, and hinder the production of LDL receptors, which clear oxidized LDL from the plasma. The liver raises cholesterol production in response to acute stress for repair, indicating cholesterol's protective role. Homocysteine, a byproduct of methionine, is a risk factor, and its levels can be influenced by deficiencies in B vitamins and H. pylori infection. The Jupiter trial, often cited to support statin use, has been criticized for conflicts of interest and misleading conclusions, as it showed no significant reduction in overall mortality and actual increases in fatal heart attacks in the statin group. Statins block hormone production, alter cellular signaling, and affect mitotic spindle formation, leading to metabolic problems, cognitive issues, muscle pain, worsened diabetes, and increased cancer risk. Primal RX recommendations for heart disease prevention: monitor cardiac risk broadly. Utilize various tests beyond conventional ones, including IGF-1, hsCRP, homocysteine, EKG, cytokine array sampling, coronary calcium index scans, and triglyceride to HDL ratio, aiming for below 2:1. Optimize vitamin D levels. Focus on LDL particle size and oxidation. Large, fluffy LDL particles are preferable. A primal template promotes this by reducing small, dense LDL caused by carbohydrates. Inflammation is the main driver of LDL oxidation. Adopt a Paleolithic diet. This diet supports endogenous antioxidant systems, optimizes thyroid function, and regulates inflammatory responses by promoting a low omega-6 to omega-3 ratio, below 4:1. It also lowers inflammatory cytokines like IL-6 and TNF-alpha, replacing saturated fats with carbohydrates, as suggested by conventional guidelines, raises triglycerides and lowers HDL. Control omega-6/3 ratio. A balanced ratio is crucial for healthy intracellular signaling in the heart. Increase LDL receptor activity. This is critical for clearing oxidized LDL. Factors that improve it include a healthy gut, leaky gut Rx, small amounts of alcohol, especially resveratrol-rich red wines, and optimized hormone levels, thyroid, sex steroids, vitamin D. Chronically elevated or abnormally patterned cortisol can negatively impact LDL receptor activity and sleep. Engage in high-intensity weight training. This is an excellent way to improve LDL receptor activity, raise HDL, and increase cardioprotective hormones like testosterone and growth hormone. Practice mindfulness. Stress reduction through mindfulness lowers cortisol, which is associated with decreased cardiac risk. Abnormal diurnal cortisol patterns affecting sleep are particularly detrimental. Consider the EPO for allele. Carriers of this gene, which increases susceptibility to heart disease and Alzheimer's, should follow a ketogenic primal diet with significant saturated fat and limited dairy. This helps increase LDL particle size, making it less susceptible to oxidation. Limit LPA particle risks. Individuals with elevated lipoprotein A, LPA levels, which increase calcific plaque formation risk, should adhere to a very low carbohydrate, low dairy ketogenic Paleolithic diet. Choose NMR over VAP for particle analysis. NMR provides a more accurate assessment of LDL particle size than VP due to methodological flaws in VAP. The author emphasizes that heart disease is a disease of inflammation, heavily influenced by diet, lifestyle, and hormonal balance, rather than solely by cholesterol levels. The Primal Rx advocates for an evolutionary approach to diet and lifestyle to prevent and manage heart disease.